Media portrayal has shown ECT as a electrical shock given to a patient who is wide awake. Most of the media portrayal or most of the folklore surrounding ECT is pure myth. Hi, my name is Dr. Parth Goyal and I'm a consultant psychiatrist at Parth Hospital, Ahmedabad. Today we are going to talk about one of the most widely used yet one of the most misunderstood treatment options in psychiatry. That is, we are going to talk about electroconvulsive therapy, or in brief, ECT. ECT is not a newly found treatment. In fact, some of the oldest forms of ECT treatment have been around since the 1930s. In the earlier times, ECT was not as refined and it was done in a very crude manner. Since the 1950s, a lot of modifications have been made to the ECT process, including the use of anesthesia and muscle relaxant. So now, whenever the patient is given ECT or the stimulation is delivered, the patient is under general anesthesia. Therefore, the patient does not feel or experience any kind of discomfort or pain during the process. However, with the changing times, the media portrayal of ECT is still been the same. Media portrayal has shown ECT as a electrical shock given to a patient who is wide awake, as a result of which the patient experiences immense pain and convulses or moves rapidly, uncontrollably for a period of 1 to 2 minutes. These visuals have led to the development of significant amount of stigma towards the procedure in general, and for most patients it is being used as a last resort or as a form of punishment for not having the necessary willpower to overcome psychiatric illnesses. The true depiction of ECT treatment is as follows. Before ECT is given, the patient is given a dose of general anesthesia, as a result of which the patient becomes unconscious and is not aware of anything that happens during the process. This anesthesia is the same anesthesia that is being used during a surgical form of treatment. After giving the anesthesia, the patient is given a injectable muscle relaxant which relaxes the entire body of the patient. Therefore, as shown in media portrayals, there is no abnormal, excessive, violent jerking that the patient experiences during the ECT treatment. Following which, there are 2 electrodes which are placed at very specific areas of the scalp or the brain, and a electrical stimulation is delivered to the patient which is controlled and is timed for its delivery. There is no wire that is attached to the patient. It is a very sophisticated machine that is used in order to stimulate the patient for the exact duration of time that we want, and an exact dose of electrical stimulation is then delivered to the patient, as a result of which the patient experiences a seizure. However, given the fact that the muscle relaxant has already been given to the patient, there is no violent jerking as seen in a normal individual experiencing an epileptic attack. Following the termination of the seizure, the patient then comes out of the anesthetic state, feels a little disoriented for a period of 10 to 15 minutes, regains consciousness, and is then allowed to go home. During the entire time period of the procedure, the patient's vitals and medical signs and symptoms are very carefully monitored by an experienced team of psychiatrists, anesthesiologists, and trained psychiatric nurses and staff members. After the procedure is completed, the patient is awake, conscious, oriented to time, place, and person, and is able to follow commands. Is the patient discharged and asked to come for another session? The reality of this therapy is that it can be done on an outpatient basis. Very few patients who are extremely aggressive or violent require hospitalization for ECT. ECT is a very brief, short procedure which gets completed before you could even complete reading one entire page of a newspaper. It is not something that causes any kind of distress or harm or pain or suffering to the patient. The only long-term or short-term side effect of ECT is that of amnesia. Amnesia refers to the inability of the patient to recall events or memories from the past. Please note, ECT does not cause any permanent amnesia. The duration of amnesia of ECT can last from a few days to a few months. Typically, at the end of an ECT course, in around a time span of 1 to 3 months, the patient completely regains from this amnesia and is able to recall and recollect all necessary details that were previously a part of his or her memory. Most of the media portrayal or most of the folklore surrounding ECT is pure myth. The problem is that there is a negative perception because patients who have experienced minimal side effects or patients who have a very low tolerance or threshold for side effects have spoken very negatively about it. And patients who have had positive experiences or life-changing experiences with ECT have not very openly and vocally supported this treatment. So I request you to consider all the medically relevant facts about ECT very carefully before making a decision. I also encourage you to ask your psychiatrist as many questions as necessary to understand this treatment and the value that it can bring to your life. Please go in with an open mind. The final decision is always yours, but get all the necessary information required to make this decision. Thank you.